Good morning, everyone. Buenos dias. I am so pleased to introduce Dr. Diana Ramos, California's second Surgeon General and the first Latina Surgeon General. As California's doctor, her mission is to advance the health and well-being of all Californians. Raised in South Central California, Dr. Ramos received her medical degree from the University of Southern California and completed her residency training in obstetrics and gynecology at Los Angeles County University of Southern California Medical Center. She also holds a Master's of Public Health degree from UCLA and a Master's of Business Administration degree from UC Irvine. Within the academic sector, she has served as an adjunct associate professor at the Keck University of Southern California School of Medicine. Dr. Ramos is past chair of the American College of Obstetricians and Gynecologists, secretary for the Executive Board, and my fellow board member of the National Hispanic Medical Association, and co-chair for the Women's Preventive Service Initiative Implementation Committee. Please join me in welcoming Dr. Ramos.
Good morning, buenos dias. Such a pleasure to be here. And I must admit, being from California, the time is not so easy. So waking up this morning was a little bit of a struggle, but I think I've had enough coffee. So I am happy to be presenting on what we are doing in California. Start off by saying I have no disclosures, and I want to share with you what we are doing with adverse childhood experiences. By show of hands, can you raise your hand if you have heard of adverse childhood experiences or ACEs? Okay, so some of you have, some of you haven't. So this is a great opportunity for me. Also, I want to share how adverse childhood experiences impact life, and then more importantly, what the role of social determinants of health and health inequities play with adverse childhood experiences. I think there's no better way to start out than by sharing a case study. As a physician, oftentimes we understand things more completely when we hear a story. So I want to start this story, and this is courtesy of Dr. Vincent Felitti, who is one of the lead researchers that founded and did the publications on adverse childhood experiences. So here we have a 28-year-old patient that was 401 pounds. Dr. Felitti had an obesity weight loss program at Kaiser Permanente San Diego, and this was a patient that he saw. And he said, please, Diana, share this, and the patient has consented to sharing her story. So oftentimes when we see a patient that is overweight or obese, we think, okay, we need to be able to prescribe to them increased movement if they're diabetic, support with their diet, hypertensive, right? And we start going down the line. Are they hypothyroid? Let's treat that. And we oftentimes may forget that there may be an underlying story, an underlying reason for the condition that they are experiencing. So this patient, after being involved in Dr. Felitti's weight loss clinic, because that's what he had a bariatric practice, after 51 weeks, the patient was down to 132 pounds, 29 years old. And we may think, wow, that's fantastic, right? How did they do it? What ended up happening is that the patient, 6 months later, ended up going back in weight, increased the weight. And we have to ask ourselves why. And that's what he did. He said, Diane, I saw this over and over and over again. And finally, he asked the question. He sat down and he asked, so what's happening? Help me understand why it is that you gained the weight back. And he said, Dr. Felitti, when I was a child, I was normal weight and I was being sexually abused by my father. She said, he said I was pretty, I was beautiful, And she said, I felt that it was that beauty that was attracting that negative attention to me. She said, I would start to eat as a way to protect myself. She had a younger sister who also was pretty and cute, and she encouraged her younger sister to also overeat and gain weight because she wanted to protect her younger sister. She didn't tell her younger sister the why. But she said, when I went down to 132 pounds, I started to get negative attention from men. I started to get men who were married coming on to me. She said, I felt uncomfortable. I wanted to go back and feel protected. And she started to eat again, and she gained the weight. So this was one of many stories that Dr. Felitti has documented, and there really is over 20 years worth of data that was followed through from that Kaiser Permanente study, CDC-funded study on adverse childhood experiences. So now we know that adverse childhood experiences play a major role. So our office has produced this video that I think will give a nice summary of what adverse childhood experiences are. So we can get it going, please.
Adverse childhood experiences, called ACEs, are stressful or traumatic experiences that occur in childhood, like violence, abuse, and growing up in a family with substance use or mental health problems. When a caring adult or supportive environment doesn't soften those adverse experiences, or when they are ongoing or overwhelming, they can lead to a prolonged activation of our stress response, called toxic stress. Think of toxic stress like this. Our bodies were designed to escape predators quickly. Imagine you're walking through the woods and you see a bear. Your brain signals your body to release stress hormones like adrenaline and cortisol. Your heart begins to pound and your body prepares you to either fight or run from the bear. And that's useful if you're in the forest and there's a bear. The problem is when children face threats to their physical and emotional safety, and this system is activated over and over and over again. What was meant to protect you begins to do the opposite and becomes damaging to your health, creating long-lasting wear on your body and brain. Children are especially vulnerable to the effects of ACEs and toxic stress because their brains and bodies are still developing. The toxic stress from ACEs and other adversities such as poverty, racism, discrimination, and natural disasters can disrupt the normal functioning of vital bodily systems. Simply put, toxic stress can result in long-term mental and physical health conditions. Not only that, but the effects of ACEs can be passed from parent to child for generations through the biological changes and behaviors associated with ACEs and toxic stress. A person with 4 or more ACEs is twice as likely to suffer from heart disease, cancer, and stroke, 4 times as likely to develop depression, and 12 times as likely to attempt suicide. The good news is that safe, stable relationships and environments and other interventions such as physical and mental health support can reduce the risk of ACEs leading to toxic stress and stress-related health conditions. To learn more, visit www.osg.ca.gov.
So that was a brief overview. I'm a multimodal learner, and my husband always says, wow, you're using an animated video. I said, you mean it's not a cartoon? No, it's an animated video. So I hope for those of you who are like me, we're able to really get the bigger picture. So I know that this conference is on movement, on inequities, and really trying to eliminate the inequities that we have and promote opportunities for everyone. So the video highlighted how adverse childhood experiences play a role in lifelong health. I want to bring to your attention that by addressing adverse childhood experiences, and this is a CDC slide, but addressing adverse childhood experiences, depressive disorders can decrease by 44%. 44%. The best depression medication, the best, will decrease depression by 50%. On average, the medication decreases depression by 30%. But this is in childhood, it prevents it by 44%. So starting to be proactive, starting to think of, from a public health standpoint, what can we do to actually prevent? For those chronic obstructive pulmonary disease, decreases it by 27%. Asthma, 24%. Coronary heart disease, 13%. I mean, you can go down and you can look at the health conditions that can be improved. When I teach medical students, I say to them, so why do you think? Why do you think that this is happening? And you know, they start to realize and connect. And you have to realize when you're growing up in an environment that is negative, what do you want to do? You want to self-medicate, right? You want to help heal and maybe change your state, change the mood. And you do that by smoking, using drugs, using alcohol. And that's why when you address ACEs, you can decrease smoking by 33%, heavy drinking by 24%. So when you're healthier overall, your socioeconomic challenges can actually be improved. So that's why you see a decrease in unemployment rate, and high school education is improved, and health insurance is improved. So it's a whole trajectory. Up to 21 million cases of depression can be prevented. 1.9 million cases of heart disease and 2.5 million cases of overweight and obesity. So you talk about movement. Yes, absolutely. This would be one way to address movement disorders from its inception and all the negative consequences of overweight and obesity, hypertension, diabetes, you know, subsequent movement disorders that can develop, and then more importantly, just help people be on a more positive trajectory. 1 in 6 adults have experienced 4 or more types of ACEs. So in general, for those of you who are not familiar with the Adverse Childhood Experiences questionnaire, there are 10 questions. And we say if you have 4 or more, that puts you at the higher risk of toxic level. And so 1 in 6 adults experience 4 or more types of ACEs. And this is national data. 5 of the 10 top leading causes of death are associated with ACEs. So we saw that whole schematic of the diseases. So preventing early trauma can improve the health of an adult. For those of you who are in the healthcare system, you know, ACEs scores of more than 4 are associated with more than 3 ED visits in the past year, compared to those with an ACEs score of 0. I was giving grand rounds at UCLA in the emergency medicine department, and they were already screening for ACEs, but the physicians didn't know that that was something happening on intake. And then they realized, wow, we have the data that is going to help direct us how we can maybe reframe our care that we're providing for the patient. Because if somebody's coming in for asthma, remember ACEs can decrease asthma by 24%. Somebody's coming in for asthma, maybe there's a question or two that can be asked that can truly get to the core of why the patient is there and help support them. It's not advancing. Thank you. In terms of musculoskeletal outcomes in ACEs, you can see here that there is a higher odds ratio for mental health comorbidity in orthopedic surgery patients. So I had our team pull some of the data on movement disorders. Physical disability requiring assistive equipment is higher. So basically, increase in fracture, physical inactivity is a higher association with ACEs, lower muscular strength in women over 50, again, higher with an association, higher association of ACEs. And you may be asking yourself, how did you get this data? Well, California is actually compensating Medicaid providers for ACEs screening. $29 is reimbursement for screening for ACEs, for getting that 10 questionnaire completed. So this is how we get the data. So you have to complete a learning assessment, and coming up in the presentation will be the QR code if you want to actually go through the ACEs Aware training so that you know what is being taught, and then they can bill for the screening. So screening is not enough, we know that, and so there is investment that is being put into communities on innovative programs to help address ACEs in the community. You can see here the higher number of ACEs, the higher association with other movement disorders, and again, they pulled this data. So with more than 4 ACEs, there is increased child and adolescent chronic pain, fair and poor rated self-health, physical disability, poor health, quality of life, somatic pain, headache. I mean, that's with 4 or more ACEs. You can read what is happening with 3 ACEs, with 2 ACEs. So there is a lot of association and correlation. So how common are ACEs? And this is overall, and I'm always one of like, which one's the most common? And substance use disorder is the most common ACEs that was reported, followed by physical abuse, parental separation, and sexual abuse. So I want to highlight that this is not always the same in every culture. As part of the initiative that my office is leading, we are coming up with a campaign on educating the public on what adverse childhood experiences are and what can be done. So we've had focus groups listening to Latino populations, listening to Alaska Native, to Black populations, to LGBTQ plus populations. And one of the things that stood out to me was the fact that physical abuse, and well, actually, let's look at mental illness, sexual abuse. You can see this. Emotional abuse is that in the Latino population, and this was brought up many times, we have nicknames for our children. Maybe say gordito, right? Which means chubby. And it's done in a loving situation, but really those words stick to a child, and they grow up with those words. And so you're gonna see in a slide that's coming up how in the Latino population, there's actually more negative experiences in childhood. And part of that was identified by our focus groups as, we use some nicknames that are not always so good. So it's gonna be our opportunity to highlight and reinforce some positive terms that we use. And one of those terms that I heard growing up, my grandmother used to call my uncle, who was 1 year younger than me, mi rey, my king. Okay, so we were growing up together, and I would listen to her, and I thought, oh wow, that's so nice. She could have chosen any other name, but it was a positive term. And so this is something that we can start to do, is start to promote and start to break the cycle of negative terms that we don't realize have a lifelong impact. So you can see here the breakdown of the percentage of the number of ACEs, and 37% had no ACEs, but you can see 4 or more had 12%, and this is from the behavioral risk factor surveillance. So the percentage of adults in California with 4 adverse childhood experiences by race, ethnicity. So you may be saying, okay, California? Why do you even matter? Well, we matter because we are 1 in 8.5 people in the United States live in California. So what we do in California is really impacting a large proportion of the nation. So the other thing too is that we know that we are a model for many programs in other states wanting to replicate what we're doing. So they may not have the seed money to develop the programs, but so they want to replicate what has been done in California and just modify it and make it their own, which is what we encourage everyone to do. So looking at by race and ethnicity, here you can see that these are 4 or more ACEs. So remember, that's the toxic stress. American Indian, Alaska Native have 31.4%, 1 in 3, if you just stop to think about it. And now remember all the negative trajectory health outcomes. So we forget that the health outcomes of an American Indian and Alaska Native actually are worse than the Black population, than the Hispanic population. But the numbers are so small that we oftentimes overlook them. But you can see here, 1 in 3. And then you can see that African American is 25.1%, Hispanic 23.7%. So all you need to do is look at the ACEs and you realize, wow, okay, maybe I'm starting to understand why there are more negative health outcomes in the long run over a life course. Nationally, you can see here a map of those reporting 4, again, that's the toxic level, or more ACEs from 2011 to 2020. And this is from the MMWR. So wherever it is that you live, you can look at your state. There are some states that are not testing for ACEs or doing the ACEs evaluation, so that's why there's no color. So this brings me to really one of the big takeaways that I really am wanting to promote as Surgeon General, is that 80% of health happens outside of the healthcare setting. And what do I mean by that? Well, as an obstetrician gynecologist, there were times when I was seeing patients in clinic that I maybe had 10 minutes to see a patient. You do a quick prenatal check, fundal height, and you look at the weight, and okay, you're doing great. You move on. But that's not the care that we want to provide. Or maybe we wrote a prescription and we hoped that the patient would fill the prescription and realize later on that they never filled it, because it's about 24% of all prescriptions don't get filled. And many times that's because patients don't understand the reason, patients don't have the funds to be able to get the medication. So all of these things are things that we need to take into consideration. What we oftentimes forget, it's the social and economic environment, it's the health behavior, the physical environment that is really playing that bigger role in that patient's health. So we forget that maybe, or you may not be aware of, that it took an hour for that patient to take a bus and get to where you are, or they don't have a babysitter to be able to follow up and come see you again after you gave that medication. So 80% of health happens outside of the healthcare setting, and as healthcare providers, for those of us who are physicians in the room, we have to remember that we have to look for cross-collaborative programs, opportunities to really elevate the recommendations that we are giving our patients. So that's why my priorities are adverse childhood experiences and toxic stress. I'm bringing that 80% happens outside of healthcare into these priorities. As Surgeon General, it is codified in statute that I focus on ACEs and toxic stress. Initially, when the office was first started, the focus was on pediatrics because the first Surgeon General was a pediatrician. And as an obstetrician gynecologist, I'm bringing it back to where it started, which is in the adults. And as you saw from the first case study where Dr. Folletti had shared, it really all started with the adults. And I'm gonna go into a little bit more explanation and you realize the 2-for-1 opportunity there. Mental health, 44% of mental health issues can be eliminated, prevented by addressing ACEs. And reproductive health. As an obstetrician gynecologist, I would be remiss if I wouldn't take advantage of my lifelong experience in reproductive health and integrating the importance of that into the work that I'm doing, specifically in California, focusing on maternal mortality. And I'll share with you a little bit more. So let's do another case study. So this is a 6-year-old complaining of wheezing. Has a history of asthma and uses an inhaler as needed. At school, the teachers say, well, maybe they have attention deficit disorder. I'm not sure, right? So you're in the ED, you're in the pediatric office, and you see this. And what is the one thing that we want to do? Well, let's make sure that they're using the inhaler correctly, have the medication. But if we stop to ask a little bit more, we would find out that the parents are vaping, that he lives in a multifamily household, there's a verbally abusive father, the mother has a history of postpartum depression, and the parents were separated until recently. So there's a lot of things happening in the background that we sometimes don't take into consideration. So we know that ACEs can accumulate their effects beyond childhood because that toxic stress leads to repeated danger and the cortisol levels, which are high, as well as all of the immune system gets impacted, and that follows into adulthood. So for our child that we just saw, we can see that there's parental mental illness, that there's emotional and sexual abuse, maternal depression, and there's alcoholism and drug abuse. This child has 4 ACEs already, 6 years old, coming in with asthma. And now we look at the environment. We have to take into consideration, is there, depending upon where you're living, are there natural disasters that are happening in the community? Is there a history of structural racism or lack of jobs? All of these things come into play in how we are interpreting health. So for this child, we really need to focus on, yes, there is a physical problem, but what's happening outside in the community that is impacting him even more. So taking that into consideration, our office has developed a curriculum called Safe Spaces, and this is specifically for the educational system. It's training that helps those who are in the educational system recognize and respond to signs of stress and trauma. It's brand new, it launched this summer, and it is broken into 3 categories: 0 to 5, elementary school, and then high school. It's a 2-hour curriculum, English and Spanish, and it helps those who are in the education system recognize what potentially could be happening in a child who we think is ADHD when in actuality they're not, and what can you do? So this is a self-paced curriculum. Encourage you to look at it if you're interested in learning more, but the health education system is not just for the teachers, it's for the people who are working in the front office, for the people who are working with coaches. I was giving a lecture, and there was one teacher who said, you know what, we had a child who was not showing up to school for 3 days. And it was the front office person that said, oh yes, I know that child. His parents, live in China, and he lives with a caretaker. And had we not known that information, we would have missed the opportunity to help and understand what was happening with that child. So everybody that is touching the lives of children in the educational system is encouraged to take this curriculum. It's free, and it's available, like I said, in English and Spanish. Other things I mentioned earlier that we're doing is promoting the awareness of what adverse childhood experiences are and stress. We're focusing on young adults, 16 to 25, and then the caregivers of those young adults and those people in their lives, and then the healthcare providers, educators, and early care providers. So we're coming up with a media campaign that's going to be cross-collaborative, the voices of trusted partners wanting to avoid stigma, break down the barriers of stigma, and that's going to be done through apps and virtual programs. Lots of great things that are happening from California. So overall, movement is health, and I took this from the CDC. We know that there are immediate and long-term benefits. Immediate, you sleep better, less anxiety, lower blood pressure, and you can see the long-term benefits of really encouraging movement. And earlier this morning, I was doing a podcast with Claudia, and we were talking about being able to actually move in your community. You may live in a community that is not safe, that doesn't have the adequate sidewalks, that may not, we're here on the East Coast. There may be snow, there may be rain, right? I took it for granted coming from California that you can walk all the time, but that's not the reality. So the one thing that I encourage folks to do, I would always tell my patients, is dance. Dance, turn on some music. I personally like Celia Cruz, Mark Anthony, and you just can't help but not move when you start hearing Celia Cruz, right? So whatever it is, whatever music it is that you like, turn it on and just go with the flow. when I was a child, my grandmother would say, "Mija, come on, we're gonna have a dance party." I'm like, "A dance party?" And then she would put on Juan Gabriel, El Noa Noa, and we're like, "Oh, okay, let's start dancing." And so you just get to move. And we all know that moving helps the endorphins, just helps you feel better, change your state. So some of you may be saying, okay, these adverse childhood experiences, they're so bad, but what can we do? And this is what we can do. We can have a positive childhood experience to buffer all of that adversity. And these are things that are done in the community, and there are things that you can do for yourself, but this is things that can be done in your community. And that's ability to talk with family about feelings, sense that the family is supportive during difficult times, participation in community traditions, feeling of belonging in high school, feeling support by friends, having at least 2 parent adults who genuinely cared, feeling safe and protected by an adult at home. The more positive childhood experiences a child gets, the better their adult mental health. So this breaks that negative trajectory. I can tell you, having grown up in a single family household, my mom was a single mom, coming from Mexico when she was 16 years old, working 3 jobs at a time to help make ends meet. I was a latchkey kid. Probably my ACEs score from where I was raised and live was probably about a 7. And I think, what happened to me that I'm overall okay? And it's these positive childhood experiences that help me. So I would come home to an empty apartment with, my key, but I knew that my aunt was across the building in another apartment, and she would say, "Mija, are you home?" And I would come over, and she would say, "Come, here's some cookies." And my mom didn't buy any chocolate chip cookies, so I knew she had the good cookies. And she would say, "How was your day?" She would sit down and just say, "How was your day?" I thought, wow, okay. So it was part of those positive experiences that really helped balance some of all of the bad stuff that was happening outside. And we have to remember that it just takes one person in a child's life to be that positive experience so that all of the bad stuff that's happening is pushed away. So these positive childhood experiences really is critical and key to making a difference in people's lives. And this is just another way to highlight the fact that we need the strength in the families, financial stability, because yes, we can't forget the fact that you have to work three jobs to make ends meet. Promote social norms that protect against violence, help kids get a good start. So this is where the Boys and Girls Clubs come in and really helps children be in a safe place. Teach healthy relationship skills, connect with activities and caring adults, and intervene to lessen immediate and long-term health. Our office has some self-help information that they have developed, but I wanted to share this. So whenever you're down and you just need to change your mood, yes, get up and dance. But the other thing too is I would say, try doing this. And we're not gonna play the whole thing. I'll tell you when to stop. We can stop it. Thank you. So that's so critically important, is that we forget to laugh. I remember my son being 18 months old and just standing there and laughing. I think, what happened to us? We forget to laugh, right? So whatever it is, pull up, have that screensaver on your phone and play it and laugh, because that in and of itself is very healing, and it helps, you're having a hard day and you think, okay, it's not so bad. Look, if a little child can find joy in a tearing paper, it's not so bad. So take care of yourself first, and that's, the resources on our website has that information. So for a mom, we know, and this is my area of specialty and passion, is maternal mental health conditions really are so critically important to address, because we know that pregnant people with depression have an increased risk for preterm delivery, low birth weight baby, but then more importantly, the disparities are even greater for pregnant Black people with depression. 2.3 increased risk for preterm delivery as well as low birth delivery. So critically important. So when we think about mental health, it's not just the health of the one person, it really is the whole family. Even if the person is not pregnant, that person in the family, whether you're a man or a woman, really impacts everybody in that dynamic. So we need to keep that in mind and not forget. ACEs can lead to toxic stress. The first 9 months shape the rest of your life. And we oftentimes forget that, because we know that if there's stress in that mother's life while she is pregnant, that can cause epigenetic changes in the baby. That can cause toxic stress. It could cause dysregulation in endocrine and immune disorders that can lead to lifelong complications. ACEs and perinatal outcomes. Again, there's low birth weight, there's higher risk for pregnancy loss and preterm birth. So you talk about an opportunity to prevent complications in reproductive health, complications in movement disorders, addressing the adverse childhood experiences is that common denominator. And this is the questionnaire. For those of you who are not aware, there are 10 questions that you can see are pretty straightforward and simple. And again, it's 4 or more that really puts you at that higher level of ACEs. I said that maternal mortality, reproductive health is one of my areas of focus, and I can't help but focus on the fact that 23% of all mental health conditions, including suicide and overdose, are the leading cause of maternal mortality. We know that 60% of maternal deaths can be prevented. And if you look at mental health, that's so critically important. Hemorrhage is 14%, cardiac and coronary conditions, 13%. So we talk about movement is life. So critically important to have a healthier pregnant person before they become pregnant so that we can avoid that. The impact of depression and anxiety, really, you can see here how it impacts the child and the adolescent. There's a more difficult time with bonding during childhood and adolescence, poorer relationships. It just really cascades on from the mom to the child. And for those of you who are saying, wow, okay, I didn't know about ACEs, I want to learn more, I invite you to scan the QR code and get educated. You can get 2 units of continuing medical education, and if you're in California, you can actually, and you have an NPI number, you can actually bill for doing that ACEs screening. You saw the 10 questions, and you can get reimbursed for that $29. More importantly, there are resources that are available to help address that. With mental health, I can't help but highlight the fact that 1 in 5 adults experience mental illness each year, 1 in 25 serious mental illness, and 1 in 6 youth aged 6 to 17 had a mental disorder each year. And half of all lifetime mental illness begins by age 14 and 75% by age 24. So talk about an opportunity to make a difference. So if you are depressed, if you have a mental disorder, you're not going to be moving. It just like perpetuates itself onto all of the movement disorders that you're highlighting. In California, similar to what's happening nationally, mental health is a leading cause of hospitalization for children 18 and under. And you can see here some of the data for students in terms of chronic sadness, and the rate of suicide among Black youth in California doubled doubled between 2014 and 2020. LGBTQ plus, 40% of students said that they had difficulty in terms of being able to do their normal activities. So nobody is immune. So as a result, California has invested over $4.7 billion on coming up with a behavioral health solution, an innovative way to address mental health, behavioral health, to address suicide prevention, and all of this with the focus of advancing equity, bringing into consideration the voices of everyone in who is oftentimes overlooked, so Black, African American, American Indian, people in the rural populations, also as well as LGBTQ plus. We want to make sure that there is no wrong door, that the support can be obtained wherever, whenever it is wanted, and that it is free of stigma. So there are innovative ways that it's going to be implemented, from apps to media campaigns to programs in the community, peer-to-peer support. Over 40,000 community health workers, funding has been provided for them, because we know that physicians, healthcare professionals trained are not going to be able to meet the demand. So we're looking at peer-to-peer community health workers. So overall, we're addressing toxic stress and ACEs, not just by research, but more importantly, through screening, clinical care, providing that trauma-informed care. We're looking at the local levels, because every place is different, and looking at cross-training, competency, and building public awareness campaign. So with that, I hope I have intrigued your curiosity as to how adverse childhood experiences can really be the source of prevention, really be the source of a solution to change all of the negative health trajectory that many people face, and put them in a healthier area, so that equity can be achieved by all, and we can all be a healthier, not only California, but a healthier nation. Thank you.
Thank you so much, Dr. Ramos. We're going to invite the audience to come up and ask any questions that you may have, but I wanted to start off with the first one. In discussing health equity and access to care, Hispanic communities experience some of the widest health disparities in the United States. Why do you think it's important to have diversity in medicine and in the healthcare workforce?
So this is a great question, the healthcare workforce, when we are looking at Hispanics in particular. So Dr. Cesar Padilla from Stanford University, along with Michael Galvez from, he's also Stanford affiliated, but Central Valley Hospital, began the campaign. This is the second year of the National Latino Physician Day. About 6% of all physicians in the United States are Latino, and we know that our numbers are growing. And we know that when the healthcare provider looks like the person that they're taking care of, we have increased rapport, increased compliance. You have that 10-minute appointment slot, so wouldn't it be nice if that rapport was created by the fact that you understood the culture that they're coming from? We have similar rates with the Black population. The Black population is only about 7% physicians in the United States. So we're working to not only increase the number of physicians, but also increase the number of nurses, the number of PAs, everybody that can provide that support. And if we can't train enough people, we have to train folks with understanding of what the cultural importances are for the various cultures. So what does it look like? What is for a Vietnamese patient, for a Persian patient, for a Latino patient, a Black patient? What are the critical words that we should make sure that we include, so that they can trust us and want to listen to what we're advising?
Great, thank you. Yes, please, introduce yourself.
Hi, I'm John Shaw from Next Wave, and I very much appreciated and enjoyed the presentation. And I have to admit that my area of joy is my addiction to bubble wrap. So popping bubble wrap is just as good as repping paper. what I'd like to think about is context and continuity. So you talked about ACEs in between, and I'm familiar with them for years, but you also talked about the prenatal stress that I know from looking at asthma creates an atopic reaction in the child, which carries over into their childhood and so on. And then you talked about the PCEs that can be protective of the ACEs risk may not be inevitable, that it can be treated. And what I'm wondering is there a way to longitudinally track from prenatal stress through ACEs to PCEs? Is there a tool to collect PCEs to be able to analyze that progression?
So is there a tool? Not that I'm aware of. Okay. Is there data? Absolutely. So I mentioned earlier that Dr. Felitti was one of the key researchers. So Kaiser has 20 years worth of data on looking at ACEs. And so there isn't a tool to look at the longitudinal. That would be the healthcare record. Wouldn't it be wonderful if ACEs screening was part of every person care, and then you just start to track and provide the support. And it's not supposed to be the physician that's providing the support. It's important to remember that it's like, okay, here are the community organizations, or here's the, you're gonna be seeing the social worker, whatever it is that to help provide you with that resource. But it sounds like it's a good opportunity for you perhaps to help come up with a tool or share some type of insight as to what would be the best way to do that. Give me
the data. Thank you.
Sure.
Yes, please.
Hello, my name is John. I'm an artist in DC, and I love the idea of celebrating the culture through dance, already using the tools already in communities to help them be healthier people. But I also come from a community that's very distrusting of the healthcare world in general. And in your presentation, you were talking about this woman who lost all this weight and then gained the weight back. And you can correct me if I'm wrong, you were saying drugs or these, them staying on some type of medication. And in a community that's like, hey, we'd rather just smoke weed, you know what I mean, as opposed to, being on these medications for life. How do you then take that person who has dealt with this toxic trauma from childhood, who's lost this weight and can't get it back because they're stuck on some things to maintain their weight in that way, especially if they're not cool with medication?
Completely hear you about trust. In California, we are specifically being deliberate in terms of how can we rebuild that trust. And part of that is identifying the community ambassadors that can be the messengers for the healthcare system. In terms of the ACEs in adults, so this was my question to Dr. Felitti. He's still alive and he's in San Diego. And I've met with him a couple of times and I asked him, what do we do? What do we do with an adult who has an ACEs score of 4, of 7? And he said, Diana, all you have to do is listen. I said, what do you mean? He said, you just need to listen to the person's life experience. He said, when we were doing the initial studies, we would ask patients, how have these life experiences impacted where you are now? And he said, that was it. And they would start to think back and talk and talk and talk. And he said, this is how we would find out all these terrible stories and experiences that people went through. But the realization he came out with is that people just wanted to get it out because it's all inside and it's all internal and they don't have that opportunity to get it out. He said it was not the physician that was asking the question. It was just a PA, it was a community worker that they had contracted, and they had told them, you are not supposed to say anything, you are just to listen. And he said that in and of itself was therapeutic. The patient who had lost the weight and they gained it, after he asked her, how has this impacted your health? Then she realized, she made the connection, wow, this is the reason why I'm doing this, and she changed. So the analogy he said, and these are his words, he says, you know what, it's like the Catholic religion, that you go to confession, you give your worst sins, experiences, but you're still brought back into the fold, and you're included. And he said, that's what people want. So that's where community has to come in, and we have to support each other. And then they can choose, once they understand, wow, I didn't realize that, you know, all of those experiences in my childhood are impacting me in this way. Then they start to make the change on their own. I mean, look at Snoop, right? So he said, I'm stopping smoking. So you never know.
Thank you.
Please.
Hi, thank you for just a wonderful presentation. I spend a lot of time, I'm a medical historian, and so I spend a lot of time looking at the legacy effects of things that were intentionally built into our healthcare system and our healthcare trajectory. Looking past vulnerable populations of color has been baked into the cake for almost a century. How do we inculcate messaging in our education, in our medical education models, that reaffirm that we have to focus on this because historically this is what we've kind of baked into the cake?
Well, thank you, first of all, for the work that you're doing as a historian. I think it's so critically important. We cannot forget the past. But I think in creating the future and developing new history, we need to just be the voices of the stories, be the data, be the pieces of information, and ask the questions. In California, we are wanting the data that from diverse populations, and then we are wanting the stories from the ground, like how is this impacting? The one thing that I didn't share about the Alaska Native and the American Indian population is that yes, they had the highest number of ACEs, that 4 or more, but they have the highest number of positive childhood experiences, the highest number, and we forget that. And so being able to elevate those positive experiences are so critically important. So we have to be the voice and asking the questions, directing the narrative, and making sure that a diverse narrative and representation is shared. That's my suggestion.
Go ahead.
Good morning, and thank you, Doctor, for an extraordinary presentation. My name is Reverend Willis Steele. I am a steering committee member here at Movement is Life and a pastor in Camarillo, California. And we do a series of educational events. We call them the Health Brunch. So this is a selfish moment for me, because I'd love to know if your team has folk that come out and talk about the realities of depression and obesity and so forth. Our next one's on cardiovascular disease, but people come to the church for healing, and sometimes that's, from our perspective in ministry, giving them a reality of what life is, what's good, what's bad, what's not, and then how to manage. So I'd be interested to know if you have a team that comes out.
So Barrett Mansour, who is here, is part of our team, and I would say connect with her. There are many opportunities, but thank you for the work that you do, because you are one of those trusted partners, trusted voices that we know are so critically important in changing the narrative and getting the trust and helping people get the care that they need so that they can take care of themselves.
Thanks. I won't let Barrett get out the door.
Thank you so much. We have run out of time. Thank you, Dr. Ramos. Please give her a round of applause.